we are recording, and so at the end of the session, we'll offer time for questions, but you are welcome to use the chat during the session for comments, questions. Please just keep your mics muted and use the hand raise function in Zoom during the Q&A if you want to request to speak. And to access the slides and handouts, you're going to tap the Documents tab in the app or on the website and select Session Documents. Find your session, tap the link, and you can follow along there. And the notes page for the session are on page 22 of the program that you have in front of you. So I would like you all to join me in welcoming Dr. Leigh Lewis. Dr. Lewis worked for several years in the field of community mental health before relocating to the Pacific Northwest for medical school. She is a graduate of Bastyr University and completed a 2-year postgraduate training program in integrative women's health. She is credentialed as a certified menopause practitioner, a fellow of Oriental Reproductive Medicine, pardon my dog barking, and a perinatal mood and anxiety disorders prescriber, the only physician to have this combination of education and training. In fact, she's the only naturopathic physician in the state of Arizona to be certified as a women's health specialist. Dr. Lewis has been in clinical practice since 2003 with a special focus on women's health, emphasizing nutrition and exercise in health maintenance and disease prevention and treatment. She's committed to the mental and physical health of women of all ages and believes that our goal for health and wellness is a matter of progress, not perfection. This is some seriously important information to arm yourself with before going to the doctor. So we cannot wait to learn from you, Dr. Lewis. You have the floor.
Great, thank you so much. And I do just want to share that I want to be able to fill out my notes page with any good questions that we have and information that we end up sharing during this talk today. So please go ahead and, shoot a question over to the chat box or somehow, if you want, I'm not sure, I think Megan knows this, but if you know how somehow to wave in, I'm happy to answer any questions as we go along. The other thing that I want to share with everyone, and then I also want to, and I will put on my notes page, is there is a very good book called Postpartum Depletion Cure by Oscar Celorak. He is a physician in Australia who really goes through a lot of this information. And what's so great about his book, it's great, isn't it, Megan? I love Dr. Oscar, and he actually does, you should follow him. I am really terrible about social media and how to really get people in, but he does like Facebook live chats and answers a lot of questions and covers so many great topics frequently throughout the year. So certainly if you can sign up for him, for his information and possibly newsletters, grab that book. It's definitely available on Amazon. And what's so great about that book is there's actually in the very back, there is a kind of cheat sheet, or for those of us who are old enough to remember Cliff Notes, version of the book. So you don't have to, and I oftentimes buy this book in bulk, and then I keep it in my clinic. And when patients come in and they have a positive pregnancy test, I'm always sharing that book with them. But I also am very emphatic that this is not homework for mom. This is definitely something that can be used as a resource, but you don't need to be. So the title of the book, sorry, I'm just seeing this come up, is called the Postnatal Depletion Cure. They call it postnatal in Australia. And the last name is Celorak, Celarrak. And I will put that information on my notes page. You can definitely get it on Amazon. And like I said, you can follow him on Facebook, and he has a lot of great events and lectures throughout the year. So a lot of this information is involved there in that book, but I did want to just like bring up some of the highlights of that and try to ask some of the questions that I get so much from patients. And I used to, back pre-COVID, do a lot of lectures for MOPS, or mothers of preschoolers. Sorry, I forgot that there. And also work very closely with Elizabeth Wood of Matrescence, who does cover a lot of this information too in her postpartum education classes for pregnant moms. And even if you are a mom of 1, 2, or 3 kids, and it's your, second, third, or fourth pregnancy, I really do suggest you check her classes out. They're local here in Phoenix, and hopefully sometime we'll be able to get them to do them in person again, but she's definitely doing them virtually, and you can get a lot of this information and way more support for postpartum in those classes. But just to start off, like, a lot of people have these questions, and honestly, in the medical community, there's a lot of debate about the duration of postpartum. I mean, postpartum is specifically the time after delivery. So there are many answers to this question. And basically, it can be, for some women, the time between pregnancies. It can be, or just after the last pregnancy. So maybe after a mom has her first child and she's done with childbearing, how long does her postpartum last after that time? And what things do we need to be concerned about? Or is it a mom after 3 or 4 pregnancies, and now she's closed up shop, and now we're trying to get her to be healthy for her next stage of life? Another common time that we need to consider in postpartum is for the time in between pregnancies. And so what should we be doing to help us prepare our body for that next pregnancy? Whether, again, it's the second, third, or fourth pregnancy, there are things that we should be doing to be healthy during that time, to get us to have a healthy next pregnancy, and also to be healthy in that next postpartum. The duration is said to be anywhere between 1 and 3 years. There was just, I think most people conventionally would say it's within that first year is considered postpartum. However, we really did just see a new study that came out this past year that said that the postpartum period could last up to 3 years. And we know that Dr. Oscar Celerak, if you read his book, he says up to 7 years, which I don't want to scare anyone, because that can seem really scary, but it does give us some idea of how long the deficiencies that can be incurred, or the depletions, as Dr. Celerak would say, during postpartum or in pregnancy, can really last for several years if you don't do things to help to rebuild ourselves after pregnancy. And why does this become important? Again, we know that the symptoms can be, a lot of times we hear about it in the lay press as really focusing on depression and anxiety and mood issues. But we know when we work with women who or have experienced postpartum, that it can be insomnia, poor energy, decrease in concentration or cognition issues, that mommy brain that so many people talk about, weight issues, menstrual irregularity, and PMS, which we'll talk about much more as we go along. But PMS is actually a risk factor. Any of the symptoms that you have in PMS before you get pregnant can be a risk factor for those exact same symptoms in the postpartum period. period. And we know that sometimes as our hormones try to reestablish themselves, even while you're still breastfeeding, that we can sometimes have PMS symptoms even without having that menstrual cycle. So premenstrual cycle is what that stands for, but sometimes you can have those cyclical changes that will lead to PMS symptoms even when we're not menstruating yet after a baby. So now what's normal is really the big question here. And the problem becomes not so much what we can say is normal, because all of the above that I just mentioned is normal. But are there things that can compound these problems or create the situation where you're more likely to have these symptoms if we don't address them? And that's more the key. These symptoms are all normal. And a lot of times if you try to talk to your OB provider, of course, like I would say that most midwives and doulas and postpartum nurses are well educated in this. But if you talk to just most OBGYNs, they'll say, oh, that's normal, give you a pat on the back and send you out the door. And then if you try to talk to your primary care about them, oftentimes they say, well, that's normal, but you should really be talking to your OB provider. So it can be kind of this like back and forth with patients not really knowing where to turn to get some help. The main issue is if you're struggling to feel like yourself, then that's a time to, raise your hand and try to get some, maybe some more testing and to get some more clarification on your symptoms and make sure they are truly within the normal range and that you don't need to be doing something to help support yourself. I do see these questions coming up here, and we are going to address some of these things. So just to kind of back up a bit, I am really happy for, Kendra and Andy really helping to clarify some of this as being very normal up to 5 and 7 years. Again, what we know from a lot of when we work with patients, what we are hearing from those moms about just feeling like they're still postpartum for years after pregnancy. And you have to think too that, again, if it's just that one pregnancy that can still have symptoms up to 7 years, what are the risks or the compounded effects of having, again, 2, 3, 4 pregnancies? And we also know that sometimes for moms who have done IVF or a lot of fertility treatments to get pregnant with the baby that they're carrying, and then now that they're experiencing postpartum, that there can be a lot of hormone flux during that time as well. So it is just really important to kind of have these things in the back of your head. We are going to talk too about subclinical hypothyroidism and hyperthyroidism, a little bit more likely hypothyroidism, but hyperthyroidism does come into play. Just a little bit about, I'll talk about the thyroid in a second, but let me just go back here. It's really important to know what your personal goals are. And this is true of health and medical care in any stage of life, but I would say specifically during the postpartum. As many very wise women will tell you, that the first 3 months, you should not be necessarily having to run out to a lot of doctor's appointments. And I certainly don't necessarily encourage my moms to come in unless they are really suffering during that time. This is a time for you to rest and nest and develop that bond with baby, being able to nap and sleep and take care of yourself when you can, when baby does, but trying to really have that time at home as much as possible. But what are your goals after that 3-month period? Do you plan in that next several months to try to just want to reset your health post-pregnancy? Do you want to get your energy, mood, normal weight back? Is libido an issue? Are sleep issues still an issue even after baby is sleeping somewhat more consistently? Do you want to return to fertility quickly because maybe you want to have another child during, trying to think of your postpartum during that time of kind of shoring your body up to get healthy for another pregnancy? We do know that most research does suggest waiting 18 to 24 months if you're younger than 35 and you do have some more time to play with in terms of subsequent pregnancies. However, if over 35, a lot of specialists will recommend that you cut that time down to 12 months, just in terms of just being more cognizant about the fact that fertility really can drop off for some women after 35. So you do want to think of those goals that you have for yourself. If you're done childbearing, whether again, this is your first child or your fourth child, what has happened in your reproductive life that might be important as you go into your next phase of life as a mom and as a wife and as a woman just out there in the world trying to live her best life? Are we 35 to 40 to 45 years old and starting to think about perimenopause? What is our proactive approach just for future health? That's what we really need to be thinking about for those women who are just done childbearing. And we'll talk about these things. So I like to think about my 5 top supplements to take, and this really just sets you up for not having any deficiencies for most women in the postpartum. And these are a lot of times things that you were taking during pregnancy. They're safe to take all the way through pregnancy, through your preconception, if you're wanting to get pregnant again in the future, or if you're still breastfeeding. These are things that are very important to stay on, to really make sure that you have enough of the reserves, if you will, to give to your baby, but then to still have some for yourself if you're breastfeeding. And again, if you are trying to stay healthy for next conception in the next couple months, that would be a prenatal vitamin, vitamin D, fish oil, probiotics, and L-methylfolate. You can get your L-methylfolate as a part of your prenatal vitamin, but it's just really important to know that that in and of itself can be so helpful to decrease risk of postpartum mood issues. And honestly, for women and men throughout their life, L-methylfolate can really help with depression and anxiety as we are just kind of going through our normal life, being pregnant or not. But it is something that is safe to take during pregnancy, during postpartum, and can really help with some of those symptoms. For the reference ranges here, the vitamin D is really conservatively 5,000 IUs per day for breastfeeding women or women who are going to be trying to conceive again. After that, I do like to check a vitamin D level because there is the risk of becoming toxic on vitamin D. And I have heard many practitioners and people online just throwing around 10,000 IUs, and that can be too much and can really get patients into a situation where they could potentially become toxic from that dose. So sometimes getting a baseline is helpful, but conservatively, usually 5,000 IUs per day is fine. Fish oil, the recommendations, again, to help be sure that we have enough of those essential fatty acids to give to baby in breast milk, but also to help mom in terms of decreasing risk for any of the postpartum mood and anxiety disorders is 1 to 2 grams per day. We also know that Lactobacillus rhamnosus is the form of probiotic that has been found to be most helpful in terms of helping with postpartum depression and anxiety. And you can get this in the form of a single probiotic that just has Lactobacillus rhamnosus, or oftentimes in a comprehensive formula that also helps to support GI health, and vaginal health as well, if there are issues with that. Now, getting on to labs, because that's just hopefully, and I do have women that I see who have, stopped all of their supplements in their postpartum. I do have them go back onto this 5, main supplements for postpartum before I check their labs, because I'd like to see what they would look like on there. So I would have them start that again for at least a month before checking a TSH fasting, which is a thyroid stimulating hormone fasting level, vitamin D, B12, iron, and or ferritin usually comes in an iron panel that you can get from Sonora. None of these labs are going to be esoteric at all. These are all labs you could request from your OB provider, your primary care provider, naturopathic physician, and you can get them through your insurance at LabCorp, Sonora Quest, wherever your insurance wants you to go. So again, that's TSH, vitamin D, B12, iron and ferritin in the iron panel. And then one thing that I really do like to see is a morning cortisol level. And we'll talk a little bit more about that in a second, about why that can be so helpful. What we usually like to do is to check these labs 6 to 12 weeks post-delivery. What I oftentimes will do for moms is to allow them to just contact me in the postpartum. And if they are suffering from any of those above symptoms that we talked about, or just want to make sure that they're all topped off to have a healthy postpartum as symptom-free as possible, I will just go ahead and order that basic lab, those 5 basic labs for them to do. And there are actually some labs that will come out to the house. Unique Labs is one locally that will come out to your house and just do the lab right there. Literally, you can still have baby in arms. You can have it in your backyard or while you're lying down. It's very convenient for moms postpartum. But I have them get those lab levels before I even have their follow-up appointment, because it can answer so many questions for us. So, and again, I do like to check those about 6 to 12 weeks post-delivery, or if they have a history of hypothyroidism, I may even want to check that sooner. And we may need to repeat these lab levels post lactation or after they finish weaning baby. So let me just kind of look through these lab questions and make sure that or these questions that are coming up. I just want to make sure I'm addressing some of these things.
And Dr. Lewis, if it helps, we can read questions to you at the end if you prefer, but if you like this method of finding them.
Oh, you can do that.
It's up to you.
Great. Yeah, because then maybe you could even answer some of these things. Okay, so we'll just kind of continue on here. But let me, I do just want to address the issue of subclinical hypothyroidism, because I've seen this come up quite a few times here. And I would put hyperthyroidism in here as well. To back up a little bit, before even trying to get pregnant, the recommendations really are for a TSH, or the thyroid stimulating hormone, to be below 2.5. And what we oftentimes see, and I'm just going off of Sonora Quest or Quest Diagnostics Labs, because that's what I typically use, the normal range usually goes from 0.5 or 0.4 to 4.5. So you can see that 2.5 or below is within that normal range. And I'm sorry if this is really elementary to a lot of you, but this is a huge problem with that causes confusion oftentimes in endocrinology. But the TSH actually goes up as your thyroid function goes down. So when we talk about hypothyroidism, or a low functioning thyroid, which is what most of the time is the problem with thyroid issues, the TSH level actually goes up. Because what happens is the thyroid produces the T3 and T4, that's the thyroid hormones that it produces, and they circulate around the body, and the brain is constantly sampling the level of those hormones in the blood. When it notices that the T3 or T4 drops off to a low level, it increases the thyroid stimulating hormone that it produces. You can think of this as if, say your child isn't listening to you, or even your dog. I have some squirrely dogs right now. Sometimes you need to raise your voice to get them to pay attention to your directions. And that's what the brain is doing. When the thyroid isn't producing enough thyroid hormones, the TSH rises to try to stimulate the thyroid further to produce more of the thyroid hormones, if that makes sense. So the converse is true as well. In hyperthyroidism, where the thyroid gland is producing way too much thyroid hormone, the TSH needs to whisper to the thyroid. So it will actually decrease its amount of thyroid stimulating hormone, and it will actually drop off to the low end of normal, or truly low range, lower than the range. So again, in most of the time, that's going to be below 0.4 on the TSH scale. So again, getting back, we'll talk more about hypothyroidism, because that is what most women will have a problem with. But just know that anytime, because thyroid is part of the endocrine system, just like our reproductive hormones, that anytime there is a time of hormone flux going off or on a birth control pill, during puberty, during pregnancy, during perimenopause or menopause, that is a heightened time where thyroid conditions can be diagnosed. And women are at more risk for being diagnosed of those issues during that time. So when we go back to thinking of the TSH level, we have what's normal. And then we also, and getting back to that, sometimes the TSH levels are outside of the range, so too high, higher than 4.5 for hypothyroidism, lower than 0.4 for hyperthyroidism. But the thyroid hormone levels are within the normal range. That's what's considered subclinical hypo or hyperthyroidism, that the TSH level is abnormal, but the thyroid hormone levels are normal. That's the strict textbook definition of subclinical hypothyroid or hyperthyroidism. And we do see that in infertility, fertility problems, pregnancy and postpartum, and again, in perimenopause, that can also be an issue. So it's really important to just remember that there is like a huge range of kind of what is considered normal. And then we have ideal. Like I said, when you're trying to get pregnant or when you are pregnant, and I extrapolate this to the postpartum, we really like to see those TSH levels below 2.5. We know at that point that the thyroid is responding normally to the challenges of the postpartum period, and really helping mom to produce enough breast milk, to feel her best in terms of energy, concentration, cognition, be able to lose that pregnancy weight normally, all of the, and also to have like not have depression and anxiety. So to have what's, thyroid or normal thyroid mood, because we know that thyroid imbalances can really cause problems with anxiety and depression. So we'll, I'm sure, answer some more questions about the role of thyroid in the discussion part of our talk, but I hope that does clarify things more than muddy the waters around thyroid problems in pregnancy, postpartum, and just women's health in general. Finally, I think the vitamin D deficiency, B12, and iron deficiency is makes sense. We know that being pregnant really increases the need for these specific nutrients. And that also carries into postpartum. With that, we know that we want to be in the normal range, of course, but we also want to be firmly set in the normal range to be sure that we're not having, again, that kind of subclinical issue with our iron stores or iron, D levels, and also B12. So for the targets for that, just to share, is with vitamin D, I really like to see women around 50, to be sure that their vitamin D is really dialed in. B12 should really be above 800, and ferritin, which is a protein that's produced by our liver that kind of carries the iron around the body and can be an early marker of iron deficiency. I like to see that really around 50 as well. Anything lower than those targets oftentimes can be targets for us to treat women to help them feel better in the postpartum. And then also we know, just a bit into fertility, that if D, B12, or iron stores are on the low side of normal or are truly low, there's an increased time to conception and increased risk of miscarriage. So if you are trying to get pregnant again soon after delivering that baby that you have right now, it's important to make sure that all those nutrients are all dialed in right in the normal range. Again, just to note about post-weaning, we do want to check back in during that time, and it doesn't need to be right away, but especially if you are, stopping breastfeeding and then hoping to get pregnant again, we want to make sure that the vitamin D, B12, and iron stores are all where they need to be. And then also that is a time when thyroid function can change as well. So typically it's mom might need a little bit more or a little bit less of her thyroid hormone if she is hypothyroid. So what not to, and I should just back up a second, because these are being marketed very heavily. I see them all the time on Instagram. I'm not on Facebook a lot, but I do see these direct to consumer male blood tests, like Paloma is one that really does a lot with thyroid hormones and also fertility testing. And this has nothing to do with, me not wanting patients to be able to take their healthcare into their own hands. But I have seen patients bring those levels in, and then when we check them against their blood levels, whether I check them or another provider check them from SonoraQuest or LabCorp, they can be extremely different. And unfortunately, they're not different in the way that they're more sensitive and they pick up a thyroid problem that we wouldn't see on the blood test. It's actually the reverse of that actually their thyroid will look fine on those tests. And then when we check them on, like, from SonoraQuest or LabCorp, we'll actually find that there is a low normal or a low functioning thyroid problem for that patient. So I do just caution patients to doing that, because I just feel like you might be wasting money. In general, thyroid testing, these things that I've mentioned, vitamin D, B12, iron stores, and cortisol, for my patients are typically covered by their insurance. And, obviously you have to sometimes meet deductibles with labs, but just know that you could end up kind of paying twice. You're paying for your insurance already. And then if you pay for one of these boxed mail kits out of pocket, you might still need to go through your insurance to get the test. I know that myself as a provider, if I saw anything abnormal on those tests, I'd want to repeat it on a blood test anyway. So just a note about those, because I do see them heavily marketed to women all the time. What not to check? During the postpartum period, a lot of times, especially if women want to maybe they're done having babies, or maybe they know that they have so much hormone flux during the postpartum period, they want to go back onto a birth control pill. Typically, if they're still breastfeeding, that's going to be a progesterone only pill. If they're not breastfeeding, that is going to be typically a combined oral contraceptive with estrogen and progesterone. Checking hormones in either of those situations is not helpful, because we're going to get the results of you being on those hormones, and that doesn't really guide our treatment at all. The other thing is say you're having a lot of mood lability, anxiety, depression during your postpartum, or your period has come back very irregularly or very heavily or painfully, a lot of PMS, and you choose to go on a birth control pill, there's no sense in checking your hormones prior, because there's nothing we're going to see on that hormone test that's going to tell us which pill to pick or whether the pill would be best for you. A lot of times we just go with that treatment regardless of what we might find on those lab tests. If you are breastfeeding, the elevation in prolactin that is necessary to cause you to breastfeed, prolactin or prolactation, it's the hormone that causes breast milk to be made and delivered for you to give to your baby, that suppresses estrogen, progesterone, and testosterone. So again, during the time of breastfeeding, there's just no sense in really checking the hormones, because we know in most cases they're going to be low, and that's not going to stop us from choosing possibly a hormonally related treatment for you at that time. So that's why we really don't do a lot of hormone. And oftentimes I do have women who are like, I need to check my hormones. I don't feel good. I'm crying all the time. I'm fatigued. I can't sleep. You know, my period came back after 3 months and I'm breastfeeding and it's very heavy and it's just, you know, every 2 weeks. It doesn't matter what your hormones are at that point. We need to get control over your hormones. And the best way to do that is probably, not often, but again, just for the mass public that we're doing this presentation for, might just be going on either a progesterone only or a combined birth control pill, depending on breastfeeding or not. So again, we oftentimes will choose a hormone treatment based on symptoms, regardless of hormone levels. The other thing is even if you're starting to wean and your periods have come back, your hormones can be all over the place. And if we check them one day, it's going to be very different than if we even check them a week later. So oftentimes it's this hormone flux that's happening in postpartum, even after your periods have reestablished, that just make it very difficult to make head or tails of any hormone testing. Now, just to wrap up with what I have, and then we will go back and answer all these great questions that we have. Additional testing that I sometimes consider. So for women who are having a lot of mood issues, but don't want to go on a birth control pill, we know that there's this new medication that's come out that has actually been given FDA approval to be used inpatient, unfortunately, for postpartum depression and anxiety. It's an IV, but it is a hormone, and it's a hormone that we can actually get over the counter and through compounding pharmacies at higher doses, called pregnenolone. And that is a precursor to progesterone. So sometimes in women who are having a lot of symptoms and maybe they don't want to go on a pill because they want to, reestablish fertility very quickly to have another baby, or maybe they just don't respond well to birth control pills in general, sometimes I will check that, and I will use that to guide my treatment in terms of giving some pregnenolone, which is safe in in postpartum, even if you are breastfeeding. Or I will sometimes use that too if it's low. I might even add in some extra progesterone in the form of a cream or a lower dose that won't be in a birth control pill, just to help women, because again, progesterone is safe during breastfeeding, can help with sleep, it can help with anxiety, and can be very helpful during the postpartum. Also, I will sometimes check prolactin and progesterone in a woman who wants to say she's 35 years old, she had her first baby, she wants to have baby number 2, and she wants to try to schedule, that sounds weird, but plan that baby within the next year or 2. To help her, sometimes we will do a combination of herbs to kind of reestablish the normal menses, and that can be done even when still breastfeeding. But sometimes we need to check back in, because if she's even still breastfeeding, as little as 1 to 4 times a day can still be causing enough increase in prolactin that it can quash or decrease the estrogen and progesterone enough to interfere with ovulation. Sometimes that information is helpful for patients that maybe they want to, if their prolactin is higher, they want to stop breastfeeding the child that they have so that they can get started on their preconception health planning and trying to conceive baby number 2 or 3 or 4, whatever that is. So sometimes we'll check that. Or if weaning has occurred already and it's been a couple months and the establishment of a normal period has not happened, sometimes we will check prolactin and progesterone just to make sure that that's not an issue. AMH or anti-Mullerian hormone, FSH or follicle stimulating hormone, estradiol and progesterone, I sometimes will check also during the postpartum, and that would be after 6 to 12 months after weaning has stopped. If a woman is interested in getting pregnant, has been trying to conceive, and has not been able to conceive, that meets the criteria potentially if she's been trying for more than a year under 35, more than 6 months over 35. That can be secondary infertility, where you had no problem getting pregnant with first baby, but the second pregnancy isn't coming along as you thought it should. Sometimes we will check more of those hormones during that time to make sure that everything is normal, and we don't need to do any more referrals for further testing. Of course, thyroid would be in that category as well.
Dr. Lewis, we've got 10 minutes left. I just wanted to give you the
Great.
10
Yeah,
minute
I
mark.
only have 3 more lines here.
Perfect.
But after 40, and when you're done childbearing, sometimes, and again, I will also say after childbearing and after weaning of that last child, sometimes we do want to check in on testosterone. Libido can be a very large problem in the postpartum. If you're still breastfeeding, there's nothing we can really do in terms of testosterone during that time. But once weaning has occurred, we can actually check your testosterone. And if you are low, either because of postpartum or low because you're getting, anyone over 35 is at risk for having a low testosterone level that can contribute to libido issues. We can check that and we can treat it as long as breastfeeding and future childbearing is not on the table. The other thing is DHEA is another androgen or testosterone-like hormone. One of the breakdown products actually is testosterone, and we can check that again in that perimenopausal time. If there's low libido or continued low energy, that's where we want to be looking at those androgen type hormones. And then finally, just a thought about like kind of that proactive approach post childbearing altogether. So not wanting any more kids, done with breastfeeding, we really do need to look at future health, literally, for that kind of next stage or middle age life. And we want to really look back in, and I would say this is after the establishment of a normal period. So maybe about a year after delivery, we can check back in on the metabolic panel, making sure liver and kidney function is all normal, blood sugar, cholesterol, just making sure that you're healthy for the next stage of life. This is especially important for moms who had gestational hypertension, high blood pressure, gestational diabetes, or any blood sugar problems in pregnancy, or have a history at all of polycystic ovarian syndrome and endometriosis. We know that all 4 of those diagnoses carry with it an increased risk of cardiovascular disease as you get into middle age. And so we want to be sure that mom is not just healthy in the postpartum, but healthy for her kids as they grow, 'grow, and then also to be there for her grandkids as well. And that's all I have. So hopefully not too overwhelmed.
That was excellent. Lots of good information. And we had lots of questions come in through Huva and the chat. I don't know if you were answering some of them. It sounded like, did everybody clear up the supplements, the 5 supplements? Go ahead.
Oh, I was just going to say, just to review, that's fish oil, well, staying on your prenatal, and you don't have to get a postnatal. That's just a marketing ploy. So if you did well with a prenatal and it kept your iron stores and your vitamin D and your B levels healthy all through pregnancy, that's probably the best one for you to just stay on. Once women are done childbearing, sometimes I will, once they run out of their prenatals, they're done childbearing, they're done breastfeeding, sometimes I will move them just onto a multivitamin, a general multivitamin for women, again, just so they can continue that through their life. But honestly, a prenatal is great up to age 50. So sometimes I just have women stay on that if they've done well on it. So it's a prenatal, a vitamin D, a fish oil, a probiotic, and an L-methylfolate supplement sometimes is necessary if the level isn't quite high enough in your prenatal vitamin, or if you have a lot of mood and anxiety problems.
We had a question about levels from a midwife asking questions about the values they should be looking for of the thyroid stimulating hormone, B12, vitamin D, iron. Did you answer that? Morning cortisol?
Okay, so for our, just to kind of, I think what the question is what are we looking for in terms of the lab levels? For TSH, we really like to see that below 2.5, between the normal bottom of the range, so 0.4 up to 2.5. For vitamin D, around 50. For iron stores, around, so it's ferritin would be around 50. It's more sensitive to picking up a low iron than just an iron panel. So I like to look at ferritin. B12 would be around 800. And the AM cortisol, I didn't go into that too much, but what we want for cortisol is right down the middle of the road. For Sonora Quest, the reference ranges are 6 to 18. I really like to see my postpartum moms right around 12. If it's too high, that can really be causing issues with increased anxiety, increased insomnia, and also a resistance to losing body weight if your cortisol levels are too high. If they're too low, that can really be leading to low energy and low mood. And then I think, yeah, so I think, and yeah, I answered those other, ferritin is also around 50.
Excellent. So if there are no more questions live, we're kind of running out of time here. Time to sort of wrap up.
I did just want to mention again that I am going to go ahead and post just a very skeleton list of these, and I'll go ahead and fill in the reference ranges that I like to look for, shoot for. And again, just know that that is for Sonora Quest. I'll also address the issue with brands. Everything I get is available on Amazon, so it's nothing esoteric. And then let's see. Just makes sense. If you ever have any questions, they'll also be on my handout. You can always just shoot me an email. I really do not mind, giving you some information to go in to talk to your OB about, or to go in and talk to your, midwife or primary care, or whatever provider you're seeing, just to help to make sure that you're set up for success in the postpartum.
That's awesome and so generous, Dr. Lewis. Thank you so much.
No problem.
And that was a lot of information, a lot of helpful information that we all need. So if you have more questions, you can keep the conversation going in the session Q&A in Huva in the app. We are going to wrap up this session right now, but you have a little break Coming up at 3 p.m. right here in room 1, we're going to be discussing your relationship after baby with Dr. Kara English. Nicola Henry will lead the conversation about who am I now, strategies for rediscovering who you are after having children in room 2. And in room 3, founder and executive director of Fourth Trimester Arizona, Jenny Beaver, is going to walk us through creating a fourth trimester ecosystem of support for new and growing families in Arizona. Dr. Lewis, thank you so much.
Thank you.
Yes, we have a short 15-minute break between sessions right now. So take this opportunity to walk around the exhibitor booths and sponsors. Get up, stretch, use the restroom, get a snack. Don't forget that we've got giveaways and deals happening. And the leaderboard, check out the leaderboard so you can enter conference-wide contests and raffles. You can earn points by chatting in the community boards and sharing captions. And you can engage with other folks in the community boards. And then we'll stick around here until 2:55 in case you have questions about conference logistics. Thank you, everybody. Enjoy.